So they say that there are biological factors, psychological factors, social factors, environmental factors. Biological in the sense, the genetical factors. See, for example, I have the gene. My father passed me the gene. I have some psychological stress. And social factors, I have peer pressure. I am from a good socioeconomic status, and my culture accepts alcohol, and I have access to alcohol. All these are biological, psychological, and social factors. Now I use it. Once I use it, so for the use, all the biological, psychological, social factors are acting like risk factors. Once I have the risk factors, once I use, I will make some changes in the brain, definitely in the brain. That's why it's considered as a brain disease. And once the changes comes in the brain, I'll move into addiction. So today's topic is addiction, whether it's a brain disease or a choice, right? So when it comes to addiction, it's a chronic disease and a relapsing disease. Chronic in the sense it is long-standing disease, and relapse as you take diabetes and hypertension, where relapse is very common, where you get uncontrolled diabetes on and off, even though after using medication. So the same way, this is a relapsing disease, but definitely a treatable disease. It is considered as a brain disease. The last 75 years of neuroscience now definitely says that addiction is considered as a brain disease. So it's a chronic, relapsing, treatable brain disease. The definition is, it is a compulsive substance use. It can be a substance or a behavior. Compulsive behavior, irrespective of its consequences. So definition is very simple. There is a compulsive use. Irrespective of the consequences, use the substance or do the behavior. So when it comes to criteria of addiction, these are the 3, 4, 5, 6 criteria which is defined throughout the world now. So if you take tolerance, tolerance is nothing but you increase the quantity of the substance or time in the behavior as time goes on. So you increase the quantity. You start with a minimal quantity, but you increase the quantity and frequency gradually. Withdrawal meaning is whenever you try to reduce the quantity, or you stop the substance suddenly, or when the level of the drug or substance is coming down in the brain, you will have uncomfortable symptoms. These are called withdrawal symptoms. Craving is a severe urge, as after few days after starting the substance, you'll have the severe urge to take the substance, that is craving. When it comes to salience is nothing but you make it as a priority. You're now, see, if your life has a lot of priorities like job, shelter, family, food, diet, adequate activities of daily living, all these are my priorities now. But once a substance or addiction enters into your life, you make addiction as your priority. The substance will become the priority in your life, that is salience. And loss of control, there is no control. So it is not in your control. People says that you stop drinking. Why are you drinking? He doesn't have willpower, he doesn't have motivation, but it's not in that way. He will lose the control in the brain. So the last point is irrespective of harm. Even though the person knows that the substance is harming his life, I mean his social, family, occupational, personal life, even though he can't stop it, irrespective of that harm, he will use it. So this is the criteria. By the end of the presentation, you'll understand the core meaning of these words. First, the theories of addiction started like this. They said that whoever is not drinking, they're good, and whoever they're drinking, they're bad. So it went as good and bad. So it's like, first they considered addiction as good or bad, whether the people who don't drink are good and people who drink are bad. It is differentiated between legal and illegal. So it involved the criminal thing. Next came the morals and ethics. The person who drinks doesn't have morals, he doesn't have ethics. Next came, it is his own choice. It is related to the willpower or motivation. If you have willpower, you can stop. If you don't have willpower, you cannot stop. He's not motivated, he's motivated. So they differentiated in that way. So next, they differentiated through his personality. If at all someone is drinking, they consider his personality is in that way. He drinks, he will not listen. So they considered it as a personality disorder. So next, little bit of evidence then they started taking the social and environmental theory. The social and environmental theory suggests that how is your culture, how is your childhood background, how is your environment during your childhood. So it might be peer pressure, family problems, substance use in the family, parenting issues. Culture is accepting the substance use, that people in the family or in the culture, it is socially acceptable. There is a childhood adverse events like loss, poverty, violence, abuse, adverse childhood events. So anything which is related to his environment is causing him to use the substance. This was the theory. And next came the psychological theory. The psychological theory suggests that we are all born with some personality. Okay, we are all born with some personality. Whether we are born as an externalizing trait, or we are born with internalizing traits. Externalizing traits is nothing but these traits. We are all born with these traits, either externalizing or internalizing or mixed. So if you go with externalizing traits, these children have hyperactivity. They are socially active. They are not anxious. They don't have stage fear. They can express, they can talk, they can move around. And these people are more interested in experimenting. So they try the substance as an experiment and they love that high from the substance or the behavior. When you go to the opposite side, if you take internalizing traits in the sense, these children are born with traits of anxiety, low self-confidence, decreased social interactions. They are shy, reserved, calm. So these people try substance to reduce their anxiety. So if at all in childhood I have lot of social anxiety, I can't talk, I can't express. So I feel that if I join in that group who are drinking, so they will accept me socially. And people say that if you drink, you will lose the inhibition so that I can talk in a better way. So these internalizing traits will drink to reduce the anxiety. Externalizing traits, children will try for the high and they are experimental. So this theory says that we are all born with some traits and personality temperaments. With that, you try the substance. So how you respond to stress, how you respond to pleasure, how you control the impulse. There's a lot of research for impulse control traits, because now they consider addiction as impulsivity and compulsivity disorder. Like there is an impulse to take, and once it becomes a compulsion, you can't control the compulsion. So, and also delaying the gratification. The people who are born with this temperament, who are able to delay the gratification, there is a less tendency for them to become an addict. Because in addiction, you need the immediate gratification. Now, I want it now. But if there is a temperament that you can delay the gratification, there is a less chance to become addict. So this is a social theory and the psychological theory. So next came the advanced last 50 years of neuroscience said that, so there is a genetical component also. So if you see on the left hand side, there hypertension, diabetes, there is 25. See, 0.25 in the sense, it is 25%. 0.5 is 50%. So in hypertension, hereditary. So you can pass the genes of hypertension or diabetes 25 to 50%. So they say that now if you see on the left hand side, these are the general disorders, hypertension and diabetes. If you see on the right hand side, these are the substance use disorders. So definitely now they consider addiction as there is a component of genetic heritability. So there's a heritability chance in alcohol 50% and cigarette it is 60%. So they say that monozygotic twins, that is the twins who are born from the same zygote, there is a high chance of inheritability or genetic heritability than the dizygotic. So finally, they told morals, willpower, social theory, environmental factors, psychological theory, externalizing, internalizing traits, genetical heritability, and finally they consider all these things are happening anyways, but finally brain disease. So this seminar today in this PPT, we will prove that addiction is a brain disease. I'll make you understand that addiction is definitely a brain disease. So they say that there are biological factors, psychological factors, social factors, environmental factors. Biological in the sense, the genetical factors. See, for example, I have the gene. My father passed me the gene. I have some psychological stress. And social factors, I have peer pressure. I am from a good socio-economic status, and my culture accepts alcohol, and I have access to alcohol. All these are biological, psychological, and social factors. Now I use it. Once I use it, so for the use, all the biological, psychological, social factors are acting like risk factors. Once I have the risk factors, once I use, I will make some changes in the brain, definitely in the brain. That's why it's considered as a brain disease. And once the changes comes in the brain, I'll move into addiction. So if you see, so to prove that addiction is as a brain disease, I need to tell, so the brain is the organ, what is the defect, what are the symptoms, and what is the proof. Now in this PPT, I'll show you all the changes which happens in addiction in the brain. So this is a rough diagram. I'm very poor in drawing, so this is a rough diagram, but it's for a clear understanding. This is the half lobe. It's a section of the brain. So you consider this is a right half or left half. It's your choice. So the front part, the FL, is the frontal lobe. Okay, the front part is the frontal lobe. And we have frontal lobe and we have a lobe in the center. This is called central lobe. Okay, so we have frontal lobe and central lobe. Front one is the frontal lobe, center one is the central lobe. The central lobe is a space for survival, for dopamine, for reward, for pleasure. The frontal lobe is for self, personality, learning, ethics, motivation, your education, love, society, everything. Everything, yourself and personality comes from the frontal lobe. Survival and dopamine reward pathway comes in the central lobe. So if you see the diagram, there's a place called A. So this is a place from A to B. It is called the mesolimbic pathway. It's the pleasure pathway. It is present in you, in me, and everyone. So this mesolimbic pathway, if the natural rewards like food, water, sex, sleep, your routine, your favorites, your habits, everything acts on A. So when it acts on A, it will increase a neurochemical called dopamine in B. Once the neurochemical dopamine increases, the brain loves that chemical. So whenever there is an increase in dopamine in B, the brain says you repeat that activity. So for example, if I like KFC, when I eat, the KFC acts on A, it increases a chemical dopamine in B. So the brain loves it. So I will love KFC. So I will try to repeat eating KFC. So that is how we form the habit. So yeah, so the natural rewards act on the mesolimbic pathway. Alcohol, drugs, smoking acts on the mesolimbic pathway. Alcohol, drugs, smoking acts on the mesolimbic pathway. But the difference between the drugs and alcohol and the natural reward is very simple. Food, water, sex, sleep, routines, favorites, habits, or whatever you like will increase dopamine to some amount. For example, 50 units. But alcohol, smoking, drug will give a surge of dopamine in your brain, at least 10 to even 100 times of dopamine, depending upon the drug. So there is a huge surge of dopamine in your brain with alcohol, drugs, and smoking. But the pathway is same for the natural rewards and even for the alcohol. So the first evidence is any drug of abuse will increase a chemical called dopamine. So this is the first law. This is happening inside the brain in the central lobe. That is the point you should understand. Dopamine is the chemical of reward, pleasure, motivation, and also movement. So in this diagram, you can see the natural rewards like food, sex, and excitement are releasing only some amount of dopamine. But on the right hand side, you see there is a surge of dopamine. There's a lot hyperactivation of dopamine with the addictive drugs. So addiction is nothing but first thing is all drugs of abuse increase dopamine. It is hyperactivity of the dopamine. All drugs of abuse increase dopamine. It is hyperactivity of the dopamine. And this dopamine is for more time in the pathway. and it increases very fast, and it is a high surge. That is the difference between natural rewards and addiction. So once there is a surge, brain loves dopamine. Now you have many activities in your life which increases dopamine. For example, I have coffee, I have KFC, I have iPhone, I'm a doctor, I do my job, I play with my pet. I have lot of things where my dopamine rises. But once I use the drug or start smoking or alcohol, brain starts to search the thing or behavior from which it is getting the highest dopamine. So if I start Johnny Walker once in my life, now the brain understands Johnny Walker is giving me a surge of dopamine, and now the brain will catch it. So I'm getting the highest dopamine from Johnny Walker. So once it identifies the thing from which it is getting the highest dopamine, it will ask you to repeat the same thing again and again, or the same behavior again and again. So this is a dopamine chart. In this dopamine chart, you see KFC, iPhone, my blue color, attire, my self-care, car, music, sports, friends, pets, job, family, sex, coffee. All these are natural rewards. All these are acting on the same pathway, mesolimbic pathway. The chemical is same. The chemical is dopamine. But the only difference is you see on the right hand side, alcohol, smoking, drugs, cannabis are giving they're giving a loads of dopamine, more than 1,000, more than 500, more than 300 when compared to your natural rewards. So in our natural rewards, sex is the highest dopamine, which goes around 100. These are just temporary values. These are not the concrete values. Even if you take smoking, it is 2 times more than participating in sex. So there is a surge of dopamine with the drugs of abuse and the behavior. It's not only drug of abuse. Even if you gamble, even you're having the internet addiction, phone addiction, the excitement you have with the phone gives the surge of dopamine. Immediately you open the Insta reel, you have that exciting news, you see the Twitter news, and that excitement gives you dopamine. Once you're getting a lot of dopamine from drugs or gambling or something else, the dopamine level from all other things will come down. If you see the next chart, after a few days, this was Dr. Sandeep 5 years back. This is Dr. levels on the KFC, my attire, self-care, sports, sex, family, job, everything has come down because I'm repeatedly using alcohol and smoking, and brain understands I'm getting the highest dopamine from this. So it is targeting only alcohol, smoking and drugs. So I will lose interest in all my activities. I'll lose interest in family, I'll lose interest in job, I'll lose interest in pets, friends, sports, music, everything. So this is tolerance. So after hyperactivity of the dopamine and hijacking the natural reward, the third change in the brain is tolerance. So if Dr. Sandeep starts, like for example, 5 years back, I started alcohol with 90 ml of Johnny Walker. It's not only alcohol, I'm just giving an example. It can be cannabis, it can be drug, it can be cocaine, it can be meth, anything. So 90 ml. So after few days, I drink 90 ml. There is some neuroadaptive changes in the brain. The 3 receptors which you see in the first image of the brain will become 6 receptors. The brain identifies that I am getting the highest dopamine from this substance. So it will increase the receptors for alcohol, if it is alcohol. So once the receptors for alcohol increases in the brain, you need more amount of substance to get the previous kick. So with the 90 ml, once it increases to 6 receptors, I'll not get the same kick or I'll not get the same pleasure. So unconsciously, I will increase the quantity of alcohol or the substance on that day, and I'll make it 180 ml. So if you take as a series, like after 3 months or 6 months, if I drink 180 ml, the 6 receptors again will become 9 receptors. So once it becomes 9 receptors, I'll make it 90 plus 180. After 9, it becomes 12, I make it 360. After then, it becomes 16 or 15, it becomes 450. So as the receptors increase, I increase the quantity and frequency. This is called tolerance, and this is not in our hand. The change happens in the brain. I'll not intentionally drink half bottle and I'll not sleep. It is the brain which is making me drink. So this is the diagram. If you see the brain, there are multiple receptors. Initially, there are only few receptors. Once the tolerance develops, there are multiple receptors for the drug. So once the receptors increase, I increase the quantity and I'll increase the frequency. So once I increase the quantity and frequency, now all the receptors, now from 3 receptors, I came to 30 receptors, samjho. I came to 30 receptors. Now, once the 30 receptors are occupied with the drug, whenever I try to stop the drug or the substance, or I reduce the quantity, or if, so for example, if the level of the drug is getting dropped from the receptors. For example, I have drunk half bottle in the night. Next day morning, I woke up. The alcohol which I drank is getting metabolized in the liver, coming out of my sweat, coming out of urine. So all the level in my brain is coming down. So the receptors are getting unoccupied now. Once the receptors are getting unoccupied, they become hyperactive. So for a small example, if I have a dog in my house, I'm feeding it with chicken every day. Chicken every day, chicken every day, chicken every day. Suddenly I didn't give the chicken. I didn't give the meat. So what the dog will do, it will start barking, it will shout, it will not eat food, right? The same with the brain. Every day I'm drinking alcohol. One day I'm not drinking alcohol. The brain becomes hyperactive. So this hyperactive is called withdrawal symptoms. So withdrawal symptoms are different from different drugs, like tremors, sweating, restlessness, anxiety, increased heart rate, dryness of mouth, irritability, anger, becoming dull, lonely, decreased concentration, decreased hunger, decreased sleep, feeling incomplete, feeling uneasy, headaches, body pains, and intense craving. So now when this withdrawal symptoms are very horrible, uncomfortable, and painful for me, so what should I do? I should, to reduce this withdrawal symptoms usually. So this common withdrawal symptoms and very painful. So to reduce this withdrawal symptoms, I drink again. So morning, I again have the same puff of cigarette or the joint, weed, or alcohol to reduce this withdrawal symptoms. The first, I was drinking because the receptors were increasing. Now I'm drinking to reduce the withdrawal symptoms. So in the morning, I wake up, I feel restless, anxiety, tremors, headache, unable to concentrate. I don't feel like motivated to go to the hospital also. But if I have one peg, again I'm freshen up. I'll go because all the receptors, see the previous diagram. So in this central lobe, you see all the receptors are hyperactive during the withdrawal symptoms. You go to the next slide. In this, you see the receptors again calm down, because I had 90 ml of alcohol. So any person who is into addiction or substance use, first they will increase the substance, then the withdrawal symptoms will start. First I'll drink for the high and the quantity, and the receptors will increase. Next I'll drink to reduce the withdrawal symptoms. So the positive reinforcement is converting into negative reinforcement after a few days. So this is how. So tolerance, I drink more, receptors increase, I again drink more. Now, to reduce the substance, or whenever I stop, I am having uncomfortable withdrawal symptoms. Once uncomfortable withdrawal symptoms, to reduce the withdrawal symptoms, I drink again, receptors increase, I drink more, again I get more withdrawals. To reduce the withdrawals, again I should drink. Again I drink, receptors fail. So this becomes a trap. Now, Dr. Sandeep got trapped in the tolerance and withdrawal cycle. People say, you stop drinking immediately. But if I stop, I'm having uncomfortable withdrawal symptoms. How can I stop it? Who is there to help me out? There's no answer. I have to drink. Then only I'll be active.